Talk Radio. This is Project Independence and You, Talk of the Town on LIU Public Radio. I'm Kristina Liu, your host, producer of the show, along with my co-host Paula Ewell, who is the Deputy Commissioner of the Department of Services for the Aging, and Otto Lowe's co-host, friend, volunteer, PI ambassador. I mean, all-star of the show. Our first guest was just like, look at this guy. I love when people meet Otto for the first time. It's really, I feel so proud. I feel like a proud mom. I do. Right. I'm like, yes, this is our Otto.
This is ours. You can't have him.
That's right. He's
I'm a real, like the things that Dr.
Dallas was saying.
Is I find really, really interesting. The whole mental health world. Yeah. The only thing you have in life is what goes on between your ears, and everybody's brain and mind work differently. And it's interesting, and your hope is that most minds will work in a positive way.
Right.
And unfortunately, that's not the case. We know that. But within your own world, which is all you can do anything about, we can't control world politics or world wars, none of which I'm an advocate of.
Right.
But you can try to work on yourself and try to help people around you, and that's all you can do. You can't fix the world.
No, and Otto is referring to, if you missed the first hour of our show, we had on Dr. Fran Dallas, who is from LIU's Psychological Services Center, and it's a really great program, a great interview we had with her, and the fact that it's open to the community at large, obviously students
it's not
as
just
well.
for students.
And that's why I think it's
LIU.
because that's why, and I thought it was too good to be true.
And they provide virtual
and
services.
every time I come across a program like this, I'm like, oh my gosh, like there's actually, because it's hard, right? And that's a major issue with mental health services is the paying for mental health
and
services.
finding the resources.
Yeah, it's
where
just,
are they?
I mean, and the wait lists, and it's really a tough process, and I love that they offer they're a very low fee sliding scale, and then you have these graduate students.
It's not there's no insurance.
Yeah, that's amazing in and of
the
itself.
Positive, frankly, of that, what I heard is, in order to get insurance, you've got to have certain kind of diagnosis.
Right, to get it covered, right.
To get it
I
covered.
think they still need the diagnosis for their own clinical, assessments. Like you need the DSM, code, but they don't have to worry which is the one to put in, and
to
this
get
is
paid.
Right.
No, and the fact that it's right here on campus, and as Paul mentioned again, that they do virtual programming, and I mean just so many individual counseling, group counseling, family counseling, and I think this is a great partnership, for Project Independence, and that's why as I sat here and I'm like, I can't wait to give this to our staff, because I think it's such a good tool for our toolbox. At Project Independence.
So.
And these are second-year doctoral students who are learning the field, who are getting to practice, and who come with already a lot of their own knowledge, but then the whole knowledge base of the doctor.
The support
so it's
system
the support, and you're learning it the right way, and getting into that kind of program is just so wonderful. I mean, and when you take away the insurance and the money part,
right.
you go in with a different attitude. It's not like, this is going to cost me $50, and you don't have to measure how much this
it's so true, because that is the barrier.
And I think
often.
people do have to measure that, because it's a real. Even with insurance, you might have to pay $50.
I have my own friends and family, and unfortunately, so much is not covered by insurance. Which I hope will be the shift as the world becomes more aware and the conversations
and the whole another world is drug related and
all of it.
No, and I'm glad we talked about the psychiatry prescription aspect of things, because that is a real problem, right? And I have this conversation often with my family, because I have different family members who are prescribed different things, and I do believe a lot of their dosages are off, because you could see like something's not, and as Dr. Dawes was saying, so much the talk therapy piece is such a big piece of the puzzle, so it's not just, and a lot of these, you'll get, and listen, there's a lot of wonderful ones. I don't want to sit here and say everything is terrible, but it's something that you need to be aware of, because, like you just get that prescription, and that's not, we're saying it's not a magic pill.
Yeah.
Right? Like, so it's so important to really have these kind of talk therapy things and all different modalities of kind of how to.
Well,
And you know, it's well known that the combination of medication and talk therapy and psychotherapy, that's where you're going to get your best outcomes.
Yeah.
You know, usually just taking a pill, that's not
Well,
going to. Because you have to
unfortunately,
learn
I
all those
also
coping
have
skills.
seen personal experience where they just go to somebody so they can get their medication.
Well, of course.
Yeah, no, and that's what I'm. That's what I'm saying.
And it's no
not-
problem. It's prescription,
and it's
and you can go to 6 different people
Yeah,
and get the same prescription.
right. And
So it's
and
really
are you getting
awful.
anywhere? No.
Right.
But the service that they provide here is really not. That's not what they're trying to do here.
No,
They're not-
no.
No, and I think it's great too, is it because when you get your foot in the door of these things, they're able to connect you to different places.
Right.
If that is something that is necessary or deemed necessary. So
Right.
I just think it's so incredibly wonderful, and I love that it's right here on campus.
Yeah.
And as I said, like making these connections is just so wonderful because now they learned about Project Independence. They didn't know about Project Independence. We didn't know about them.
And now we can
and
get
now,
the word out for
and
them,
they want to
which
do
is-
programs, and they said they're willing to come out into the community and do these things.
And
which I think is-
education for staff. Like,
right.
I mean, that's, really, really
Just
important.
absolutely awesome. So once
Well,
again,
there's nothing like good psychological people and social workers.
Yeah.
That's right.
Now,
She
I
is a
believe
social
she
worker as well.
also
She is
a social worker.
She is,
from
we're a little
Adelphi.
biased.
She is. No, I saw that.
Yeah.
In
Like I did.
2004, she
You
got
too, my
her
granddaughter,
LMSW.
Yes.
Yeah, no, I saw.
Adelphi's.
She felt like a social worker to me.
Yes, yeah.
Well,
we
I
got
think
that
you're
vibe.
right.
She had a warm
We liked her
personality.
immediately.
Yes, it was very lovely.
But once again, if you want to get in touch with LIU's Psychological Services Center, you can call 516-299-3211. Of course, you could always call 311 or 516-869-6311 to get any.
Well, I think a big thing is the tool bag, as you said, Paula.
Yeah,
For
yeah.
your people,
Yeah.
the social
Yes,
workers and nurses.
yes. Because it's not, you can get it. Like, we're not in there to diagnose a mental health disorder. That's not
Right.
our primary role when we're in. We're going in to do the psychosocial assessment. What are all the pieces that maybe are out of alignment that we can try to help people
and
get
connect
back?
them.
Yeah, I
and
mean, you can
connect them.
empathize.
But some people, like I was saying, you just need someone to listen. And just someone to be there.
Because haven't you just heard that? I mean, a million, and as you were saying that too, Paul, I was like thinking, like, there so often we'll have, someone come into our office who's just like at a level 10.
Right. Just
They're
come in,
panic,
walk in.
and then it's all at the end of the day, it's like they just needed to get it off their chest and for someone to listen to them.
Right.
And it was just as simple
Just
as
that,
that.
yeah.
Like they just had to get it out. So I think that, that really is, and it sounds so easy, right? Like just listen.
Yeah.
Just
right.
listen. But it's really
Yeah.
such a skill, to do. And,
Yeah.
I was making jokes on my family, but listen, we all have friends and family who no one's really listening to one another.
Right.
But the other part of it is what I said is that people have a tendency to say to you what they think you want to hear.
Right.
And that's not the way to
Well,
fix
I laugh
anything.
all the time with my mom about that because that is something that we both struggle with because we do treat everything like it's a test, right? And you want to like ace your test. And that's so my mom's like personality. So like I would always say that to her, when she's been dealing with these medical things, like, Mom, you're not getting graded on this, like they're not, but it's like, but it's something that you have to like really just be, and I think it's a struggle, right? To be open up because you have that like insecurity and you're scared about that judgment. But when you're meeting with someone, and certainly if they are judging you, they're not the right person. So you should go see someone else. And that's something too that always struck me. And I can't remember, it was something we were doing a training at work. And they were saying, it was our mental health first aid training. That's what it was. And what stuck in my brain was that she was saying, a lot of people, will meet with someone, right? And they just don't feel, it doesn't work. And they throw in the towel. Right. And she said, listen, if you go to a
they
hair
should be fixing me.
She goes, if you go to a hairstylist and, you don't like how they do the hair, you find another one. Right. Mm-hmm. So why is that not the same with mental health? It's like, I tried therapy. It didn't work for me,
Right.
Yeah.
And it's really just important, to find that right person. I mean, I know people who have like really found the right fit and it changed their life, so it is important to, find the right person. And there's so many different people out there and different styles. And I think that,
different styles is important, by the way.
Yeah. Cause it's
And
not it's for
everybody's
different.
style.
Right.
Yeah.
Like some people go and they say, well, they never said anything.
Mm-hmm.
well, maybe that's good because they gave you a chance to talk about what it is that's bothering you.
Right.
You know.
No, and that's why I think it is important because, like, listen, some people want to talk to someone that's the same,
Is giving it
It
suggestions.
depends. Everyone's got different, feelings, and I think that's important to find kind of your right fit, whatever that might be for you. And what's nice about this center is that you're able to.
It's a great resource for us. It's great for us to give to our staff. And I was gonna mention, but I didn't get to it. Is that Otto, you weren't at the advisory the other day.
Yes.
But we had Central Nassau Guidance come in to do a presentation, and they're opening.
You were here when they were on the radio.
Show.
Yes.
So that
you
know about the
emergency center.
Yes. So what everyone
what they called it, first aid
community. No, I think
is it open?
No, but it's opening probably August, September, but it's huge.
Yeah, so the fall.
Because they were on the show.
Fall. Yeah. Oh, I missed that. Okay.
And they had the emergency
then
mental health.
Yes.
I wanted to mention
urgent care. It's a mental health
urgent care.
Yeah.
I mean, and they admit
but I wonder if
that
the
this is
doctor
not
knew about that.
emergency.
I
I
didn't
think
know
she
about
used the word. And
it's instead of an emergency room.
Right, you get to go to this.
well, people, I mean, I've had it again, unfortunately.
Yeah.
Where I know, family person had a problem.
Yeah.
And it was because of some drug-related situation.
Yeah.
And then all of a sudden, there's a catastrophe.
Yeah. Sometimes you must go to an emergency, no
right,
question. But
that's what
the doctor maybe didn't know about, because this is the thing with
it's
community-based programs.
Right.
We don't know everything that's out there, you know, and I hadn't heard that from Central Nassau, so that just to hear it and watch their presentation was very helpful.
Now, something else went on at the meeting the other day that
I just want to quickly
involved.
the Central Nassau Guidance. It's going to be opening in the fall of 2025. I'm already talking to them about once it is, having them back on and kind of promoting it. But it's the Community Crisis Center is what it is called, and it's going to be in Hicksville, which isn't too far from the North Hempstead borders.
And we can help with
But
transportation.
and we
there.
could certainly try and get you.
Yeah, and if you have a problem, Hicksville.
And you know what it is too, and they're not they're not turning people away, even if you don't live. And they were saying mainly Nassau,
Suffolk.
Suffolk.
Have them on again sometime.
Yeah, no, I said in the fall, absolutely. But they really, they were at our advisory committee meeting, and I want everyone listening. That's our advisory committee meetings meet once a month.
I missed the last one.
I know Otto, which is very rare. But our next one will be June 11th.
I was
at 10
freezing to
a.m.
death watching my grandson play baseball.
You're being a good grandpa.
It was 40 degrees there.
Oh my God.
Oh gosh.
Yeah.
Well, you could have been. It was kind of cold in our building too. So.
Yeah.
But it's really a great place. We have wonderful speakers every month, and on top of that, you get to kind of meet your neighbors. You get to meet our staff. There's always a lovely spread too of breakfast. To come through. But it's really wonderful, and that's another place that we're able to, make these relationships. And after the meeting, I was talking to the guests, thanking them for coming, and they were like, we really would like to do some kind of partnership with Project Independence too. So it's like this is what it's all about.
Yeah, absolutely.
Because we always say at the end of the day, we're a grassroots kind of initiative, and we're still a small little group of us.
We're built on a partnership model. I mean, we need all our partners.
There was somebody there who has a lot of years experience in social work.
There happened to be someone in there, who may or may not have the magic number of the year, which is 40, right, Otto?
40.
Big 40. Our very own
That
Paula.
means Paula started when you were born.
That's why we're kindred
that's
spirits.
What I said.
Yes.
My first year as a social worker.
Yes.
Whoa.
Here was Kristina.
I mean, if that's not some kindred universal stuff, I don't know what is.
So here's what I do then in those situations. You can say to Kristina, I was 40 once too.
I was. I really was.
I do that with my grandchildren.
Right,
they turn 14 or whatever.
Right.
I
Well,
said,
I was there
I
once,
was
too.
14 once. They'd look at me like, you
Right.
what?
Right.
You didn't just come out this way.
I just love, when the world works the right way.
Yeah.
And I was coming up on, I had social work interns for 20 years. I don't even know how many. I probably should count one day. But I was coming right at the end of that point where I was like, all right, I don't think I need to have interns anymore. But we were in this last, okay, we'll do it. And Evelyn, certainly. I've always wanted to make sure, because it's a great thing to have that's why I think this, this center that you're teaching people how to be really good psychologists. It's very important, and I mean, you've heard, Kristina and I almost missed each other, just like ships, just that close.
But the universe wouldn't let
And
us.
the universe said, I think I'll call her one more time, and then I'm putting her in the no pile. You know, it was just like, and miraculously, it worked.
Well,
The
I
stars
remember
aligned.
Kristina sitting in the meeting
Yeah,
in the corner
right, taking note, right.
and as an intern, and that was a long time ago.
That was a
Yeah.
long time ago, my friend. I think it was like 15 years ago. Yeah.
Yeah.
15, 16 years ago, maybe.
Yeah. But that's the beauty of, that's like where it can start.
Yeah, right.
And then it becomes, oh, maybe I could do this, and I like doing that. And then you start getting the experience, and then you start passing the batons. And Kristina someday could have an intern.
Yeah.
No. She's like, no,
Well,
thanks.
we had the group, the social worker law firm.
Yes.
that
Oh,
has the
yes.
program
They will,
at
Yes.
and
Delphi.
you see, you're really on the money because that's who's presenting at
Next
our June
June.
11th advisory. The
They're
Goydell Law
wonderful.
Group.
Are they going to be
They're
at
gonna
There-
be
yeah.
there.
okay.
They're presenting.
That was very good. That was a good plug, Otto. You didn't even realize you were doing it.
Goydell. That's
We have Goydell,
Wendy Goydell.
who is
right?
the intersection
And
of
Connie
social
Wasserman.
I mean,
work
they were
and law.
very good.
Connie
and
Wasserman,
the
yeah.
program of helping Delphi
Yeah.
social work. I mean, we're at LIU. LIU, obviously, we've learned, is a great
Oh,
school,
absolutely.
has lots of great programs.
Yes.
And Adelphi is a good school, too.
Yeah.
And they have
Yeah.
a great social
Yeah.
worker program,
Yeah.
which, as I again say, my granddaughter
That's right.
graduated from.
You can always give your granddaughter shout outs, Otto. As many as you'd like
Right.
throughout the
But
show.
she's got the same kind of personality that all social workers seem to
Right.
have, which is one of understanding and
Yeah.
empathy.
Yeah.
Right, and if you don't have that, you're probably in the wrong field.
Well,
I
you should
shared-
be doing something
I
else.
shared interns with Connie.
The what?
Yeah.
I shared interns with Connie because
Yeah.
there was a grant program, and it was very complicated, honestly, for us on our end. But every intern would rotate like 3 months. So you would just
You would just get your footing and then you're out the door.
Just getting people out in the field, and then it was like, now you go to your new setting and your new. But Connie, I would pass the baton to Connie, and we would just confer with some of the interns what worked, what didn't. So it was just wonderful. So when I see them,
some intern programs are
some
very
interns
good,
don't
and some
belong
of them
in the.
you wind up making photocopies for people.
Oh, yeah,
which
no.
I
That's
have
the wrong one.
We
a
Not
son
us.
who
They
did.
put me to work
Right.
in my
Yeah.
internship at the town.
That's why I said after the 20 years, I said, I think that's it for me.
Well, let's hold on. We have to take a quick break, and after the break,
wow.
Paula, Otto, and I will continue talking about what's going on in the town of North Hempstead. You're listening to Project Independence, and you talk of the town on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Community Talk Radio. This is Project Independence, and you talk of the town on LIU Public Radio. We're going to jump into what's going on in the town. We're catching up because it's been a while since we've been live. Prior to the break, we were talking about Paula celebrating her 40 years of social work service, and many more to continue.
I want to ask Paula a question.
Ask away.
Sure.
Do you remember your first experiences in terms of social work that made you realize that's what you wanted to do?
Yes. I do.
Charge away.
What?
Charge away.
Well, it's
I like that, Otto.
it's a little
Charge away.
sad. So,
Yeah.
but I actually first did internships in a nursing home, and it wasn't the nicest nursing home. It was in a very poor area, and I had pretty good supervision, but there were so many seniors there that either didn't belong there because they should have been in the community in a much higher functioning way, or a lot of people that had no family, or a lot of loneliness, a lot of sadness. And as an intern, you were able to work with the seniors individually and just sit and spend time and talk and try to figure out they had all the basic needs because it was a nursing home, but I just saw so many places where things could be better. And just know, you really could feel like after you spent 35, 40 minutes with somebody, or however long they could tolerate, how you could feel them changing. Not that you changed them, but just the sense that someone is listening to me. And then I remember, going home and being like, that felt amazing. Like, it really was wonderful. So that was lucky that I had that. And then I stayed in long-term care for almost 20 years in different capacities before I came out to community-based social work. But there just was so many places where we could still improve. And, I saw, and Project Independence was a huge way that, how we deliver services to seniors was going to improve if we could pull it off, if we could make this work. So I was just over the moon. I didn't know we really didn't know what. I don't want to say we didn't know what we were doing, but it had never been done. We had it built.
It was a new world and navigating a new.
But nobody wanted to go into geriatric social work. It was just like, and that was, we didn't learn much about it. And I was just like, this is where this is the age group I want to work with. And I couldn't work with children. I just found it was way too sad, and but I just got so much out of it.
Yeah, well, good.
Do you know why did you actually go into social work in the first place? Like, what were you like? I don't even know if I know how to answer that question, because I got my degree in psychology. I didn't know much about. I never knew a social worker. Right.
I didn't know much about it, but I think just like you were talking about earlier, figuring out, okay, I'm going to graduate college. Now what am I going to do?
Right.
And I wasn't attracted to like the direct clinical end.
Yes. It's like my story. Yeah.
And, so I started looking up what other social work popped in there. And it was like, like you have perceptions of what is social work. But I really had zero experience. I never had even met a social worker. So it was kind of foreign to me. But once I went to like the learn about social work, and I went up, I live very close to Adelphi, so I was over there and met with people, and I was like,
you grew up in that part of the world?
Yeah. So that was really,
yeah.
So that was a huge bonus.
Yeah.
And so I could stay home. I was able to stay home. That was a big help.
Right.
And I wanted to be home. I wanted to stay home. So it was just, I loved going. I love college. I would have gone to college
forever.
if I could go forever.
You would have been a professional student.
I just loved it. I loved being in school. I loved to read. I loved everything about school.
That's good.
So, but then,
well, I'm happy
the
you
first
felt that
job. Yeah. So my first, within a couple of weeks after I got my master's, I was in a nursing home. And fairly big nursing home.
At that point, did you know you wanted to work with seniors?
Yes.
So at that point, you were just like, you already know.
So from my internship, I knew from my internship, because my second year I had to go more like the clinical. I worked for similar to JASA, and I found that tedious. I just wasn't that interesting, and it was more, you need to make X money and this insure. It just didn't feel
It's
great.
interesting that your view was that, because I think like that we talked about phases with our previous guest in life, and the phase of when you're home and you're going to stay home, but then all of a sudden stuff goes on and you really can't stay home.
Right.
Reality sometimes.
Right.
You have to go somewhere.
Right.
Long-term care.
Right.
Images of nursing homes is not particularly great.
Right.
And frankly,
and it wasn't great.
And many people really even have a problem visiting nursing homes because they find it depressing.
Yeah.
So it's a area in life, that I'm in that category where it could happen someday.
Yeah.
And your perspective of what goes on in long-term care hopefully will change for the better.
I think, it has already.
Certainly.
I'm going back to 1981. Early, the early 80s is when I was doing my internships. But
I think they try to make the atmosphere a little more pleasant than walking in and everybody sitting in a chair in the hallway. Hollering or doing whatever.
Yeah. But what really spoke to me was how much loneliness there was, and how if someone was determined lonely, and then the ways you act when you feel that way, you were medicated. There was really heavy antidepressant, antipsychotic. If someone's behavior, they may have a UTI, but their behavior's off, so now they're going to get
right. And then you're in this
you're
cycle.
Reading all this, and you learn to work with teams of other professionals. So it was a great learning experience. And then my first job, I was there not even 2 years, so I was 28, and the director of social work got fired. And I was asked to be the acting director for like a month, and then a month later I was asked to be the director.
How old were you
I
then?
was 28. I was brand new, married. I didn't know
so
what
wild.
hit me, and I had to live in that nursing. It was a lot of responsibility, because we had Department of Health.
Yeah, I mean,
you had
there's
the
so many
federal
things.
government. There was a lot of regulation. Some of it was really good. Some of it was ridiculous. But it was just very paper. Just you're always writing notes. So I took that job, and I was there 10 years. I loved it, and then I was actually kind of asked to come and join Parker Institute as their assistant director of social work, overseeing the long-term care division. So I did that for 10 years.
That was pretty big.
How
many
supervised
people are in
9.
long-term care there?
I think there were like 350. No, in long-term care, probably about 250. At the time, it was changing more to subacute, but it was predominantly long-term. So that was my area, and I was quality assurance, making sure we got everything done. But so I supervised 9 social workers there. Loved them all dearly. Had students. That was started my intern experience. But so when I was asked to leave there, my heart, it would make no sense to do what I did. It really didn't make much sense when I moved to the job at FEGS. But the timing was perfect, because I was able to work a day less, and my daughter was only my youngest was only 4. So working 4 days instead of
made a difference.
5, I was like, we could, let's see how this goes. And the rest was history. 18 years later, here we are.
Wild.
It's just pretty wild.
Well, you
but
have a lot of valuable experience that Project Independence can gain from and does.
I mean, it was just such, we really didn't know we were going to be able to do this and keep it going, and there's the political world, and there's all the other pieces of it that you have to negotiate along the way, and we were able to negotiate. But I learned huge amount. I wasn't community based. My experience was not community, so I really had to go out and figure out what are all these services, how are we going to connect them, and how are we going to have this public-private partnership with people. How does the work of the town happen? How does the government operate? But I had amazing mentors. I had Madge Kaplan, I had Evelyn Roth. You could not have asked for better.
They're two of the people plus you who
took me
influenced
right
me.
under the wing, under their wings. This is how we're going to do it.
Both of them influenced
both.
me.
And both of them were my mentors. Ev would be, and they were sitting at a table to interview me. What? How did I get here? And they were, Ev's a tough cookie,
totally.
And Ev's asking me questions, and I'm answering.
Quite a savvy lady.
Oh, she was brilliant. She was just brilliant. And once she loved you,
you were in.
Yeah.
You're in. You're
locked in.
She's still doing all right.
She is. Yeah. She's great.
Yeah.
Ev is great. So I was just immensely lucky that I came into that world with.
Well, I think the Town of North Hempstead is
my
lucky
world, knowing social work is back in my life.
It didn't have a great reputation.
Until I got hooked up with
they take
Project
your kids away.
Independence.
Right.
That's literally.
Really didn't have an image that I understood.
No.
I'm New York City, not to knock New York City, but the image back then was the social worker was coming to the house to see
take your kids away. Literally,
and that was the media also.
Yeah.
Anything you saw, a book,
any movie, anything.
The social worker came on. They were the bad guy.
Yeah.
Period.
Yeah.
I used to, when I went into social work, because even when I went in, I remember the only reason I went, I got my bachelor's in sociology, and then I wanted to go on to, get my master's, and I wasn't sure. I was like, and I'll never forget my mom calling me, and she's like, I was looking online, and I saw social work, and it just sounds like you. That's what she said.
Aw.
And then she like read like all like the things, and I was like, oh, that's good. And she's like, and then everyone's like, Kristina, you go to social work, and like even my friends, and then we're not talking that long ago, had like oh my God, like you're gonna be a social worker, you just like come in, you're like intrude in people's business, it's like it was all these like crazy things.
And there's people that probably still have that image.
Oh yeah, I'm sure. Yeah, but that's what's so special about and as we said earlier, we are biased about social workers because it's like the best, but it's such a broad profession, and that's what is so cool. Because look at Paula just saying the different experience, and that's why I encourage people to like really, you can do so much with your social work degree. I mean, my job, it has morphed into so many things of interest to me, that I was able to, that my social work skills were able, to let me do, so it's just
and obviously we have very different skills, Kristina and I.
We're a solid duo.
If I didn't have Kristina's skills like right here, I wouldn't be having my skills.
We're a solid
duo. We really
duo.
rely on each other,
and that's why she's 40 years and counting. Everyone listening, there's no retirement over here.
Well, I think a big thing is, to me, looking from where I look now, is somebody able to talk to you about a situation. And having the knowledge to take that problem that person has, try to figure out what's the best track, but also the knowledge you have of the tools that are out there that can be used. And I think that's a major area that social work brings to the table in our world here. All right, because otherwise, like I said many times, I'd be sitting there going through the yellow pages.
I know, in those days,
looking for
that big book that came.
Or even
the phone
going
book.
online now. The modern yellow pages.
It's so overwhelming. Equally as overwhelming.
What overwhelming task that is to try to find tools that can help you. And programs that can help. They're out there.
And that's the number one thing. And that's what with Project and Penn, so I was like thinking too. Our wonderful social workers and nurses that we have in the program. I mean, on a constant basis, everyone is sharing resources, and like at its core, I mean, it's either Paul and I will get saying we'll send out to them, it's, and then we'll have someone say, hey, does anyone know of a service that'll come in and clean, or something, and then someone will get back, oh yeah, try this, so it's this constant sharing of information, and it goes back to the whole point of it is like these things and life and living, it takes a village.
I mean, it covers
and it's
gamut,
really
that's
like
the thing
Barry
too.
Klitzberg to me is a classic case of if you have you're going into Medicare and there's insurance connected with it. Most people who start out who are approaching 65 find that to be pretty overwhelming.
It is, yes.
And if you can talk to somebody who knows the system, who can, and that's the key words, the system, can help you get to the system the right way. That's worth its weight in gold.
And that's big part of our responsibility too, is to what else is happening, where else can we send people, and I'm lucky. I mean, because of my license, I have to get I enjoy continuing education. So there's always something out there that's interesting that I can still be learning about.
Well,
which
that's
is
life,
really
hopefully,
fun.
too.
What?
Yeah, exactly.
Constantly learning.
Yes. But I'm required, to have 12 credits of continuing education a year for my license.
So you have to go to school?
No, well,
it's a
you
good
can
class.
go to
Virtual.
different places. I try to do virtual if I can, but I'm going to some in the evening. Because you get to meet other professionals that way, you get more resources.
Right.
But it's a very well-regulated professional field. That's
Now,
the other thing.
you say you're licensed. Do you have the same kind of license?
No, she's got a clinical license. No.
Okay.
Yeah. There's different degrees, and way back when I got an advanced credential, Academy of Clinical Social Workers, and ACE. So I could add a couple more initials if I really wanted to, but I don't.
Okay.
I don't
Like
bother with them.
Sometimes we get a guest that got initials.
Right.
I know.
No,
We
I
could spend
just
half the
stick
show
with
I know,
stick with the
talking about the
LCSW.
initials.
It was really and that's my real initial, but I'm not clinically practicing, but I am a clinical social worker.
Right.
So
You could if
I could. Yes. Yes, I definitely could. So
She wants
and
a career
my daughter
changer.
just recently got her my daughter's a clinical social worker, and she also just got her C. There's a licensed master social LMSW,
Right, which
and
is
then an
what
advanced degree would be the
Kristina
clinical.
is.
I'm MSW, yes.
Yes.
and my granddaughter.
Yes,
Right.
I think I don't know.
No,
She's
she
an M.
is, yeah.
It takes. You have to, do a certain amount of hours in
Yeah.
the field. So my daughter recently became a clinical social worker at LCSW.
She's passing the torch down.
Yeah.
The generational social work.
Well, you know
torch.
what? That's probably really great.
Oh, it
because
felt great, yeah.
You know, from a relationship point of view, you can talk to each other about
Yes.
this. Like my son, frankly, one of them is in sales, and he does almost the same type of stuff I did.
Wow.
So we're able to talk about,
Right.
you know,
Yeah.
this, like I happen to have like 60 years worth of
Right.
experience.
Right.
And I think I had the experience where I was learning throughout. You know,
Right.
it wasn't like I had a rigid view
Right.
of what was going on. So
Right.
he's now
And
in
you
his
had-
50s, so
Yeah.
I mean, we can talk about this stuff.
Yeah.
And he can, you know, I can relate to what he's doing.
Yeah, and you know, you have to learn for yourself. I mean, there's certain things my daughter will discuss with me, and I'd be like, I don't know if I'd handle it exactly that way, and she'd tell me why she should.
Well,
But
after
anyway.
the break, Paula, Otto, and I will continue talking about all things going on in life and in North Hempstead. You're listening to Project Independence and You, Talk of the Town on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Community Talk Radio. This is Project Independence and You, Talk of the Town on LIU Public Radio. We're going to jump right back into everything that's going on in the town of North Hempstead. Otto, we'll start off. I know you have a scam update for us.
Well, I found this one interesting, and I thought it might be worth talking about. Many times we wind up with complaints about customer service, all right? And then people say, well, put it on social media. You know, put it on Facebook, put it on whatever,
Yep.
the Yelp, anything, all
Yeah.
right? And I read something that said, no, don't do that. Don't put your gripe on sites because that's where scammers get their information.
Uh-oh, I'm going to have to
sense.
tell some
Because
family
now
members.
now you're going to get a phone call that says, I'm with
That's a
customer service
great
for
point.
blah, blah. And,
How can we help
and
you?
it's
Give
a
us
fake
your right.
customer service,
Right.
but they go through this thing and they pick out prospects,
Wow.
basically in sales, all right?
Right.
They're prospecting.
Wow.
So now they have a whole list of people who they can contact because everyth's there.
Right.
Yep.
How do I
You gave it all
contact
So
to
true.
them, right.
You
Yeah.
handed it to them like on a silver
So
platter.
I always thought too, put it on Facebook.
Yeah,
put
so
it on,
someone else can maybe get helped from this,
yeah,
but it's the opposite.
but the bottom
Maybe-
line is, if you think about it, you're putting all your score information on there. They can
That's crazy.
call you because you might even give them a phone number.
Can you imagine?
You know, so that struck me as being, you know, they have a fake call center and they just there
awful.
all day long calling people that they see
It's
griping
awful.
on social media.
Yeah. I'm telling you.
It's hard here. And, you know, I'm laughing. I'm just, as we're on the show, I got a scam text from. It's saying it was DMV,
I got it.
and
too.
then I have a
It's-
final notice that I have an outstanding traffic ticket. You know, that I never received apparently, and they're reporting the DMV to violate. You know, where they're reporting to the DMV, they're going to suspend my registration. They're suspending my driving privileges. I won't say do me the favor. Transfer to a toll booth and charge a 35% service fee. I'm also getting. So but you know I got to
Just
pay
click
it.
here.
I got to
You got
avoid my
this?
license literally while on the
Yeah.
show.
That's from the
I just looked at
DMV.
it. Yes. Mhm.
That's not from Easy Pass.
No, but they're telling me to go to Easy Pass. Yeah. So.
Yeah.
It's sending you over to East.
Yeah. So. Yeah, that was.
I got a Prime and Amazon one.
Oh.
Prime. Like emergency. You must pay this now or your Prime will be suspended
your membership.
forever.
Yeah, right.
You will
Forever.
never,
Oh,
you will never get on
boy.
Amazon
Please
again.
don't
Oh
do
no!
that.
Banish from
Like,
Amazon.
delete.
Oh. And she's like, that was like her husband setting it. Like, listen, you're
Yeah,
banished.
but
Yeah,
there are
I
people
know.
that still fall for that.
No, and like,
Yeah.
listen,
Oh, yeah.
you can. There are more and more. You know, I mean, like, listen, looking at this, I mean, it's alarming. So your immediate thing is like, oh my god, you know. So
Right.
it's. I
There was the
understand.
one day
how
in
it's
the
gonna
office,
happen.
we all got them within a half
Oh,
an hour.
yes.
Like 4 or 5
I remember.
of us.
Well, I had
And we
brought
were
it,
like, did
and you
anyone get
brought it
this?
up to, and I
There's
was
a
Easy,
lot
like,
of
it was
bad
the
crowd
Easy
over there
Pass
in your
one.
place.
But it was like boom, boom.
Yeah.
And we all looked at each other's phones and we're taking, say, okay.
Well, how do they get all these phone numbers?
It's out there.
You know, I mean, cell
at it.
phones used to be okay. They were fairly private. No
No.
more.
No, yeah.
Now you got to be careful
Listen,
about cell phones.
in doing research for the show, you can find all kinds of things on the internet, which I've come to realize. You know, you could it's just a few keywords, you could find a lot of stuff out. But yeah, so thank you, Otto, for mentioning. I think that's a
it's
really
important.
solid tip, and certainly something to keep in mind. Because I think we forget sometimes, right? You just like put this out there, and it's innocent. You're being, like a little naive. I get it. I've been there, but I want to remind people also that if you are listening to us live tomorrow, there is going to be the Memorial Day fireworks over at North Hempstead Beach Park. If I could find there we go. I got my paper here. It is going to kick off at 6:30 p.m. The gates, however, for North Hempstead Beach Park open at 3 p.m. So you could certainly get a spot there. It does get a little crowded. There's going to be live music. There's food. There's a bunch of different food trucks. It says there's parking fee is $10 per car, cash only. Is what they're doing.
Except for the veterans.
Yes, the veterans.
Vets get free
you can
parking,
get to a free park.
Cash only for park?
Yeah, that's what it says. It
Now,
says $10 per car, cash only.
Wow. Now this is very
I know,
interesting
I
because
know.
I went to the Asian American Festival, and that parking was free, but I went for something else, and it was $10 if it was cash, $7
Yeah, I know.
if it
So
was
I
a
don't know.
credit
This
card.
is just
for
saying,
the town. This was
Wow.
the town.
Wow.
Yeah, I'm not sure. I always thought that's what it was, and I was about to actually say that, but now that I'm looking at their flyer for it, it is it's just
Yeah,
saying
I did
cash
go to
only.
that.
Yeah, it's saying
But
cash
veterans
only.
can come into our office and get as many free parking passes, and we just sign them that they got them.
Oh, you have free parking?
We have
For
free parking
veterans,
for
yes.
anyone that's a veteran.
And you
want
could
one?
get one, my friend.
I do want one.
Well, come on over.
Well, you have, but that's just
I
it's
paid
just for
that.
events. It's
Well, you're
only,
gonna
but
save $10.
but the veterans it's only for.
Can
an
I
event.
get like a refund for all?
You can, yes,
Well,
but yeah. So
I never knew that.
yes,
Yep.
you could have gotten that for Asian Fest.
Is that available to any veteran?
yes.
No, but
Oh.
just to be clear, it's only for events. It's not like
Events.
you get a free parking.
Oh,
at
oh, I see.
yeah.
Oh,
yeah.
okay.
Oh, this
No,
is
it's
to come-
isolated.
yeah.
To the
Oh,
Memorial
Oh,
Day
it's not
park.
for
I
everything
thought this
ever.
was like
Otto thought he
Lifetime.
could just. I knew Otto was thinking he could
oh,
park.
oh.
Yeah.
Like I go to
Like
Jones
Lifetime?
Beach.
Oh, no, I
That's
know.
Lifetime.
Yeah.
Yeah.
Empire
Yeah.
State,
Yep.
whatever they call
Yeah.
it. But I can go to any state park and whatever.
Right. No, this is event specific.
Yes, event specific.
event.
That would be a
Okay.
good idea, though. Honestly.
I think that they
That would-
sometimes, there are different programs. I know that's been in.
We
in talks,
actually go
certainly.
there quite a
Really?
few times.
Yeah.
I like to walk the
Yeah, it's
boardwalk,
such a great.
and
Jones
Bunny
Beach
sits
or-
under
or-
the tree. And North Hempstead
Oh,
Beach
oh.
Park.
I haven't been there that often, actually. In my
Well,
if we've had to go
you're
for
a
different
walker.
things.
You can walk
Yeah,
the
yeah.
boardwalk, and there's also a trail.
I should go check. I should check that out.
You can walk.
Yeah.
Different.
Yeah.
And on a nice day, there's always a breeze.
Yeah.
Yes, it's
no,
nice.
it's
Yeah.
nice. We should
Yeah.
definitely try that.
And I cannot believe it, but we are, as we mentioned, we're Memorial Day. I don't know how that happened.
crazy,
We just dove right into this summer season, and that means the summer event schedule at Town North Hempstead. There's concerts, there's movies, there's a lot going on. So the first one is going to be in June, Sunday, June 29th, 7 p.m. The Sidecards / Joyride will be performing, and that's North Hempstead Beach Park. But what I love, every year they get different concerts. There's all different genres of music, and this year, which I'm sure is going to have a lot of screaming little girls, is the Beach Party with Taylor Swift experience. I'm sure it's going to be quite the event. But there's 60s music. There's 50s. There's a Billy Joel tribute. Oh, they have the Warped Tour band. I just noticed, and that's a great one.
Which
I've
program?
seen them. It's like punk rock music, from my youth. Great band. I've seen them many a times.
I don't love that.
Yeah, I don't know if that's Otto genre. There's a Beatles tribute, a Pink
Now, my
Floyd
grandson,
tribute.
by the way, I'm sorry, went to see AC/DC
Oh
Oh,
wow.
at
Oh my
Foxborough.
God.
oh, nice. Very nice.
One of my favorite.
Yes.
Well, my son and daughter-in-law and the two boys went to Boston from Pennsylvania so they could
I
see
didn't
this
know they were
concert.
still even playing.
Yeah.
And I'm saying I wouldn't know
Yeah?
one
Oh,
song
yeah, I
that they
didn't know that.
played. Would I know a song that they played?
I'm sure you would.
No.
Would I?
Yeah.
I mean,
I don't know.
the top. I mean,
would I know the names?
You're a man about town, Otto. Come on. Yeah.
I don't think I'd know the names.
I'll play you some
Yeah,
after the
it's
show.
all right. I'm gonna save everyone. I'm not
Well,
gonna
like
sing
I
it on
said,
air.
one of the big things that's generational is music.
Yeah.
Well, it's every there's something for everyone, and that's what North Hempstead has in their concert series. And then these are going to be, as I mentioned, there's June, July, August. I mean, they have quite. Oh, Dan, you can mark this down. There's a Dave Matthews tribute band on August 10th. You could send that over. There's Bon Jovi, Journey. There's all kinds of really fun things going on. And then there's Shakespeare in the park that they've been doing for a few years now. And that's King Richard III they're going to be doing. And this is presented by the East Line Theater.
Where is that one?
That is Clark Botanic Garden.
Oh, nice.
On July 12th. And there's a bunch of movies in the park, which I think is really fun for the whole family. One of my personal favorites will be on Honey, I Shrunk the Kids, which was a Kristina childhood movie. There's Madagascar, there's Moana 2, there's Shrek, Lilo and Stitch. So they have it's really fun to bring your kids,
nice.
grandkids, and just to get the neighborhood. But I really recommend everyone checks it out. They are free, these events.
How do they find out without trying to memorize the list?
You have to memorize that. Enough. You could,
online. It's
if
on the
you
town
happen
website.
to be on my magical email list,
You'll get
you
it.
also get blasted with this email a bazillion times. But you can call 516-869-6311 and get a hard copy. It's on the website. I'm sure the town's Facebook
I
will
think a
be.
separate mailer even went out.
Yes,
with
there
all,
might
with
be
all
like
the
the
parks events. Maybe you'll probably get that in the mail.
But if you want this flyer, you could certainly call me. I'll be more
Yeah.
than happy to mail it out to you because it's really a good little tool. And also, what it means is that the pools all over North Hempstead are going to be kicking off. There's a lot of early registration. What I really want to mention to people though is this reduced fee pool membership program. This is offered, which is 60% off of membership fee pricing. There's Manor Haven Pool, which is in Port Washington, and there's Whitney Pond Pool that all fall under this pool membership reduced fee. Residents of the town North Hempstead enrolled in free or reduced lunch with your school district or enrolled in a federal or state assistance program and meet SNAP guidelines are able to get this, which is really nice. And I'm glad the town offers this. And of course, there's Clinton G. Martin Park, but you have to live in the special park district. There's a whole bunch of North Hempstead Beach Park, different vehicle and different, so many. I'm looking right now. There's a whole bunch of different price things you could fall under to get that. Otto's looking. He wants pointing at.
Lucky Otto gets to go to the
Yes, he gets it right off here.
We just sit in the office and watch everyone walk by us with their bathing
But there's
suits.
Harbor Hills Pool, so if you live in that area as well, there's so many different pools that you're able to check out. So call 311 or 516-869-6311. The preseason registration is fully in effect, so you might want to get on
over
that.
there. Yeah.
This is a good one.
Oh, let's see. Otto just got
Well,
a
I
hot
I
take. He
didn't
stole my
realize it.
flyer right from under me over
It's,
here while we're on.
and I can get a $25 annual pass
See?
because of being a veteran and a senior.
See?
So maybe I'll
wow,
probably
win-win.
get it at even at half price because
There you go.
Right.
Well, you're going to have to give us an update, my friend,
I'll take a
on that.
picture of this one.
I also want to let people know that next week, Tuesday, May 27th, the town clerk will be doing a mobile passport day, which is over at Shelter Rock Public Library, which is right over in Albertson.
That's a great thing.
You could even get your passport photo taken there for $10 as well. It's from 12 p.m. to 4 p.m. Call 311 or 516-869-7977, which is directly to the clerk, to make an appointment, and then they'll let you know all the documents you have to bring to get your passport. So
Yes.
it's great. I love kind of these one-stop shops that they do.
Yep. Totally get
Because
everything
there's
done.
so many different pieces, and it can be. We talk about this all the time with all the new guidelines.
Right.
You either need a passport or the
Did
enhanced
you
ID.
get your real ID?
I didn't do mine yet because my passport's still rocking and rolling. So I'm just going
I
to.
did. It was a disaster.
Yes,
but-
Paula had a very stressful, traumatizing
heard
experience.
What?
All right, I cannot figure it out till this day. You have to bring your birth certificate. I had to bring my marriage license because I had a different name after I got
Right.
married, whatever. They insisted that they had to use my birth certificate name and add my married name with my middle name. So my license, so everything,
got a long name
everything
on
is
her,
Paula
like,
Yule
yeah.
in my whole life. My passport is going to be Paula Yule. My license is Paula Marie Garlinger Yule.
Oh.
So that's
they
how she
wanted
would
to
like to be
match that.
addressed.
And I just said, but I don't. They brought supervisors over. I said, but this is my license has been Yule for 38 years.
Right.
They said, nope. To get this enhanced, we have, But I said,
Your marriage certificate though had the hyphenated name.
My
That was enhanced
marriage-
or real ID.
Yeah.
no, but your married name. They wanted to know first your maiden name,
Yeah.
and then under your married name,
Mm-hmm.
and it came up as Paula, my Gerlinger Yule.
Yeah.
And that's now what with my full middle name is on my driver's
Yeah,
Well,
license.
it's funny you bring that up because
Like, all right. My husband thought it was hysterical,
well, we went to AAA. If you belong to AAA,
No,
you
I
can
know
make
you
Yes,
told
Otto,
me.
and I kept
I
telling
belong,
people
yeah.
that you
Yeah,
did that because
and it was great.
Yeah.
So we go, and because like you, Bunny, Bernadette, my wife, her maiden name was McGrath. Her married name next time was Curtis.
Oh, my
then
gosh.
it's Los. Then
Right.
it's So I figure, okay, we're going to bring death certificates. We'll bring it all.
Right.
All right.
Otto came with
that's
it,
what
rolled
I
in a
did, too.
suitcase.
Because
Yeah.
because of what you described.
Yeah.
So we get there, and the guy looks at both our licenses. He says, "You already have real ID."
Oh, Otto.
The little thing
Good
up in the
for you.
corner, the star.
So Bernadette's, does it just use Los, or did they have to put all the
Bernadette
Put her,
and Los. That's all.
That's
Yeah.
my whole license has been that till this point. Now it's four
She's
other
got, 40
names,
years of
and it's
some
never
sort.
gonna. Now it's not gonna match my passport.
Yeah, now it just seems like a bit of a headache.
I
for
have
you
to
do.
figure this out.
Well, it's tricky stuff. Like I went through. My father's name was Otto Los, all right?
right.
And his middle initial was H, just like mine.
Yeah.
Oh.
So I wind up using
So
Junior.
junior, yeah,
That was such a pain because once my father was gone,
right.
all right.
Right.
So my grandson's name is now Otto Los.
Aw, that's great.
And I told him, I said, Otto, start to use the J in the middle permanently.
Right,
Yeah.
just use
all right?
it. Yeah.
Because here's another little story. All right, I tried to start one of these betting accounts just for
Right,
drill
right.
for fun. All right, really. I enjoy. I'll put a couple of dollars on a
Gotcha.
horse
Yeah,
race
yeah.
for fun.
Right.
all
Your best life, Otto.
So I apply online for this betting
Right.
thing, DraftKings, I think it
Right.
Oh,
was.
yeah, there you go.
And they turned me down, and I'm saying,
Because your grandson
there's
already has
another
one.
let's
Otto
go.
Los
And I
on
give you a
here.
phone number you can call
Right.
to find out
It's like
why.
nobody turns Otto. Nobody puts
why
Otto
you
in the
were turned
corner.
down.
Yeah.
So here's what happens, all right? I get the person on the phone, and the guy says, you died. I said, I did? All right? We can't give you
Right. We can't give them to
you
dead
can't
people's
gamble with
names,
us.
right.
All right. Okay. I said, well,
You're like, but I'm very much alive, sir.
I said, my father died a long time ago in 1986.
Before DraftKings,
I said,
DraftKings.
that's probably the Otto Los that you're saying
Right.
died. So I said, I'm here and I'm talking to you. The guy says, I can't do anything about it. We use this particular website
Wow.
that,
oh my gosh.
yeah. So he says, you'll have to go online and
God,
fix
Otto.
all of this.
Oh.
I said, no, I don't
No,
have to go
no,
online
no.
and fix nothing.
No,
I said,
no.
I am just not going to gamble.
Right, right.
This
right.
was a sign. This
That
was a
your
sign
lesson,
from him.
Otto.
But that
Oh,
name
that's good.
stuff. if
I
you
really
have-
like that,
Oh,
Otto. Well, thank you for that. That chuckle
was
I
very
really
exciting,
needed.
right? That
Made
was
my
about the
eyes
town.
tears.
Right.
I just picture Otto like, well, I didn't die. I'm here.
Yeah, I told him. I said, I'm not dead. I mean, but if you don't want me to gamble with you, I won't.
You don't want my money? I'm
No.
alive. Yeah.
I actually
it's
did
really
it
good.
because they give you $200 to sign up.
Oh, now we're serious. I really like what was going through his.
And you can gamble
Play
with
with that,
200
right.
and then get
And then
out.
that's-
So
You
I
know what?
figured, well, I'll
You're
probably
just
make
gonna have
a
to kick it
killing.
old school
Make
and
a
go to
killing,
OTB,
right.
Otto. That's what you're gonna have to do. But thank you for sharing that. Yes, it can get quite confusing, and I laugh because the same thing always happens with my brother and my dad. Thankfully, they don't have the same middle name. Because my mom always is terrified that my poor brother will get mixed up with my dad, and nobody wants that.
It can happen.
Yeah. Well, thank you for the great conversation and the laughs as always. I want to thank everyone for listening to Project Independence and You Talk of the Town. I'd like to thank Paul and Otto for another great show. Project Independence and You is a production of Long Island University Public Radio with a special thank you to Dan Cox. Join us again next Friday at 10 a.m. on LIU Public Radio. Goodbye and have a great week.